Hi, I'm Tom Faerber. I'm a board-certified oral and maxillofacial surgeon. I practiced in Overland Park, Kansas for 32 years. Today we have a follow-up on a patient who had some large tori, they're benign growths of the jaw, and he had a pretty large surgery to remove these bone growths that grew on the outside and the inside of the jaw. So, George, how long did that issue bother you?
Well, it had been growing for a number of years. It's a condition that never really stops. So when I was young, I just assumed everybody had them. I guess it really isn't the case, but it came to a point where I was having a lot of problems sleeping at night, and since the procedure, I think my tongue now has a place to live.
Mm-hmm.
As far as being benign, it is affecting me a bit. But,
Yeah. Right.
In most cases.
Did you have problems with eating and food collecting underneath them and trauma in your mouth due to them at all?
Well, heavens, yes. So after you eat, I have to sweep my mouth with my finger because there'll always be food that would be stuck in your gums that you don't even realize are there.
Yeah.
And yeah, it's just a condition that I've learned to live with, but now I'm glad I don't have.
Right, right. How did the surgery go? I mean, that's a pretty big surgery. Did that knock you down for a while?
It really went on without a hitch. Jan is your nurse anesthetist. She was great. Given that my procedure was so big that you needed to have her involved, and she was great. She followed up with me. And yeah, it was a pretty big procedure. I relied on the medicine, ibuprofen and Tylenol,
Yeah.
and I'm still relying on the ibuprofen and Tylenol.
Okay. And we had a post-op complication, an infection. How are you doing after that? Because we had to get you in and numb it up and drain it.
You got all that terrible stuff out of my chin. I'm well on the recovery mode. Yeah, it was a little bit painful, but after it was taken out of there, it felt much better.
Right.
One thing I have to add that, after my initial surgery, if you have a job that has you on your feet, I highly suggest that you take 2 weeks off rather than 1 week off.
Mm-hmm.
If I had a sit-down job, maybe I could have gone back to 2 weeks off, but it was very difficult when I came back, and that's just one thing I'd like to add into my testimonial.
Sure. That's good advice. Did you feel you had some comfort here since we had an accredited office-based surgery center?
I found that really curious because I told my associates at work, I'm in the medical profession, that we did it in the office, and they're all dumbfounded.
Mm-hmm.
When you do surgery in his office, and yeah, he's got his own suite. And then realizing now that you have a board-certified operating room, which I would think would make this location that more appealing.
Mm-hmm. Yeah, good. All right. Well, we'll continue to follow you up, and we're going to get a quick CT scan before you leave today.
Thank you very much.
Okay, all right. This is a professional case discussion on George. George had tolerated very large mandibular tori for over 20 years, and now these growths on his lower jaw were associated with food trapping and persistent pain when eating and recurrent ulcerations. Excision of these growths was extensive, and PRF growth factors were placed at the excision sites to assist with healing and hemostasis and tissue regeneration. The postoperative CT scans show the dramatic contour improvement achieved after these growths were excised. The patient at the end result was much more comfortable postoperatively with greatly improved eating and speech. This extensive surgery was completed in our accredited office-based surgery center due to the level of anesthetic requirements and complexity of the surgery.